dear students, welcome back. Now we are going to see the joints of the thorax. We have finished all the bones which are present in the thorax. Normally the bones present in the thorax are anteriorly the sternum, laterally the ribs, and posteriorly the thoracic vertebrae. And all these bones are joined together forming a cage, thoracic cage. Now we are going to see each and every joint which are present in the thorax. So this is the anterior view of the thorax. Here we are going to see the joints which are present on the anterior aspect. So actually this is the sternum. As you all know that this is the sternal bone, isn't it? And the sternum has manubrium and the body of the sternum. At the end it is having another small part, that is the sharp part of the sternum, that is the xiphisternum. And the joints present in the sternum, are manubrium and the sternum. A joint is present between the manubrium and the body of the sternum. That joint is called as manubrium sternal joint. Manubrio-sternal joint. This manubrio-sternal joint is a secondary cartilaginous joint. It is a secondary cartilaginous joint. It permits only slight movements of the body. It permits slight movements, that is sliding movements, which are taking place in between them during respiration. About 10% of people, these two bones are fused. Okay, so this is called manubrio-sternal joint. Manubrio-sternal joint is a secondary cartilaginous joint. It permits only slight movements, that is the sliding movements of the manubrium on the sternum, which occurs during respiration. This is about the manubrio-sternal joint. And coming to the xiphisternal joint, so here the joint is formed between the xiphisternum and the body of the sternum. Okay, the inferior aspect of the body of the sternum with that of the superior aspect of the xiphoid process forms the xiphisternal joint. This is a synchondrosis type of joint which occurs between the body of the sternum and the xiphoid process. Okay, and one important aspect of this xiphisternal joint. So this xiphisternal joint ossifies at the age of 40 to 50 years, in between 40 to 50 years. So these are the two joints present in the sternum. Okay, now another important joints. So here the sternum also forms a joint with the clavicle called sternoclavicular joint. We are not worried about the sternoclavicular joint because that joint comes under upper limb. So we are not dealing this joint here. Now here the ribs, isn't it? The ribs are articulating. So the true ribs, that means the first 7 ribs articulates with the sternum, called as through its costal cartilages. So the rib, the anterior aspect of the rib is joining with the cartilage. Anterior aspect of the rib articulating with the costal cartilages, forming costochondral joint. That means this costa means rib and cartilage, costal cartilage. So a joint is formed between the rib and the costal cartilage. So this joint is called as costochondral joints. Chondra means cartilage, costa means rib. Costochondral joints. So this is also primary cartilaginous joint. So the costochondral joint is primary cartilaginous joint. Here no movement is taking place. Here no movements are taking place in costochondral joints because they are primary cartilaginous joints. And also the first costal cartilage, first costosternal joint. So all are this costochondral joints are primary cartilaginous joints. Now coming to the chondrosternal joint, that means the cartilages which articulating with the sternum is called as chondrosternal joint. What do you call? Chondrosternal joint. Chondra means costal cartilage, sternum. So the joint formed between the costal cartilage and the sternum is called as chondrosternal joints. So in this, the first chondrosternal joint is a primary cartilaginous joint. Here it does not permit any movement. So this is also the first chondrosternal joint does not permit any movement. So this mainly helps in the stability of the shoulder girdle. It mainly helps in the stability of the shoulder girdle and also the upper limb. Here you people know that the first costal cartilage also forms the articulating surface for sternoclavicular joint. So here this joint is mainly helps in the stability of the shoulder girdle and the upper limb. Okay, but the remaining from second to seventh chondrosternal joints are synovial joints. That means the movements are taking place in these joints, where from second to seventh costal cartilages articulate with the sternal costal notches. Okay, so these are synovial joints. Okay, so that means each synovial joint will have a capsule, isn't it? So if you see, each and every joint is covered with a capsule. Each and every joint is covered with capsule. But in the second chondrosternal joint has one peculiarity, because this joint is formed with the second costal notch, isn't it? Sternal costal notch. So this notch is formed by the joining of the body of the sternum and with that of the manubrium, forming an angle here. In that angle, the cartilage is getting articulating. So because of that splitting angle, so the joint cavity is divided into two. So the remaining joint having single cavity, the second chondrosternal joint has two cavities present inside the joint, and each joint is covered by a joint capsule. Okay, and these are all synovial joints, and each joint is reinforced by each joint is reinforced by a triradiate ligament. So radiate ligament. So in this side you can see that ligament clearly. So if you take each joint, it has three divisions. The ligament is having three divisions. So this is superior, middle and inferior divisions. Three divisions are present. So this is called as triradiate ligament, which supports the chondrosternal joints. So this triradiate ligament is seen in all the joints present, all the joints of chondrosternal joints from first to seventh costosternal joints. We can see this triradiate ligament and also the capsule. Capsule is also giving support to the joint. So capsule acts as a ligament. So two ligaments, one is the capsular ligament as well as the radiate ligaments. So this is about the chondrosternal joints. Now, how many joints now we have seen? Manubriosternal joint, xiphisternal joint, and first costochondral joint, and also the remaining costochondral joints from first to seventh costochondral joints, and next one is the chondrosternal joints. In that, the first chondrosternal joints are immovable joints and the remaining joints are movable, that is the synovial joints. And each joint of chondrosternal is reinforced by capsular and triradiate ligaments. And next, coming to the interchondral joints. Interchondral joints, the name itself mentions that interchondral joints. Chondra means cartilages. So each and every cartilage is joined to form another joint called as interchondral joints. What you call interchondral joints. This is the interchondral joints. Okay. So the 5th to 9th costal cartilages. So this is 1, 2, 3, 4 and 5th. From 5th to 9th. From 5th to 9th. 5th, 6th, 7th, 8th, 9th cartilages. From 8th to 5th to 9th. In some books it has given from 7th to 9th costal cartilages combined to form as interchondral joints. Okay, so here now we will see the 5th to 9th costal cartilage articulate with one another. Only costal cartilages. So 6th one is articulating with the 5th above costal cartilages forming interchondral joint, and again 7th one articulates with the 6th costal cartilages forming another interchondral joint, and again 8th one articulates with the 7th one, again 9th one articulates with the 8th one forming interchondral joints, whereas the 10th one articulates with the 9th with the fibrous tissue forming, it is united with the 9th with a fibrous tissue. Okay, and these joints, these interchondral joints also synovial joints. Interchondral joints also synovial joints. So these joints are also mainly used in respiratory movements. Okay, so the joints, whatever we have seen here, are mainly used in respiratory movements. Okay, this is about the joints which are present on the anterior aspect of the thorax. So what are the joints present on the anterior aspect? Manubriosternal joint and xiphisternal joint, costochondral joint and chondrosternal joint and interchondral joints. And on the posterior aspect, there are another three joints present. One is the intervertebral joints, costovertebral joints and costotransverse joints. Those joints we will see in the next video. Thank you.